Happy holidays. I say that with much trepidation because of the year that thankfully is coming to a close, the year 2020. We've never lived through a year like this. That is, those of us who were able to live through the COVID-19 pandemic. Hundreds of thousands of our fellow citizens weren't so lucky. By the way, I'm Frank Diamond, the managing editor of Infection Control Today. We want to give infection preventionists and other healthcare professionals the information that they need to battle COVID-19, and not to mention all the other dangerous pathogens that are out there. But COVID-19 is the story of the year, the decade, the century, and Infection Control Today has been on top of it. Why? Well, I started out in newspapers. Reporters knew that you are only as good as your sources. During the course of the last year, we enlisted some of the best experts in infection prevention to become members of our editorial advisory board. I've also worked in trade publishing for many years too. And I've never encountered editorial advisory board members who are so involved and so passionate about what they do and who want to make a publication the best that it can be. They contribute articles to both our print publication and our website. And when the company that owns Infection Control Today launched this Medical World News broadcast channel, my editorial advisory board members stepped up then too as well. Tonight, I'm going to feature interview excerpts from two of our editorial board members who've been so amazingly generous with their time. Let's start off with Dr. Kevin Kavanagh. Dr. Kavanagh is the founder of a patient advocacy organization called Health Watch USA. Google him by all means. You'll find a lot of information about Dr. Kavanagh. In a recent interview, I asked Dr. Kavanagh if he thought we'd ever return to the old normal, the way things were before COVID. This is what he said.
First of all, I don't think we're ever going to go back to the way that it was. Online shopping and pickup, I think, are here to stay. People like that. Working at home, that's here to stay. People like that. Production in many different industries is actually up because instead of spending long times traveling, people are actually working. And costs are down. So we're going to see a transformation. We're never going to see us going back to the way things were. It will get more normal, but not the same normal. Currently, I feel this virus is going to become endemic. It's already in animals. It's in dogs, cats, and we've seen it enter the mink population in Denmark, necessitating the culling of 17 million minks. And that virus you've seen mutate to a form that they were worried was resistant to the vaccines. So I do think vaccines are going to come about. I'm worried that they are going to cause a significant immune response, not one that's dangerous, but one which may discourage people from getting the vaccine. We see this with the shingles vaccine. People take the first dose, they don't want to take the second dose because they had a fever and were sick. That may be very problematic. This virus may repeatedly enter into our population because it is now residing in an animal host. And I also think that we're looking at a mutation at some point where we're going to have another vaccine made and distributed to the population. Now, the good news on that front is that with the new technology of mRNA, it looks like these vaccines may be able to be printed in the matter of weeks so that you'll have very rapid response. And as we get geared up with manufacturing and distribution, we won't see the delay like we're currently seeing. But I do think we're going to be living we're going to be living differently, and we're going to actually have a different type of outlook on infectious disease. I feel that masks in many venues are going to be here to stay. And that may be actually a good thing. If you're sick or you're coming down with a cold, you'll be able to wear a mask and go out in public where before maybe you weren't able to do that because you were socially looked down upon. Granted, I'm not advocating that you have a cold that you go out and do that, but you know, sometimes when you're living alone and you have the sniffles, you have to go out. And this will add, I think, an extra layer of protection to our society. But I tell you, Frank, I don't think we're going to go back to the way things were. There are a lot of problems that this virus has created. There are a lot of solutions, but those solutions mean that we're going to be doing things differently. We'll be looking at the good old days back before 2020, and they won't be the same as what we'll be living in the future.
As you know, the flu of 1918 killed about 60 million people around the world. Could this have had the potential to have killed that many people around the world if the world didn't basically bring its economy to a cold stop as it did?
Oh, I definitely think so. And you've seen estimates such as that out of New York City in the initial stages of the pandemic. But you need to remember, it's not only bringing the world economy to a semi-halt, but also we've had great advances in medical care, the giving of oxygen, the proning, mechanical ventilation, the ability to give life support, anticoagulation, and all of this has helped to improve survival that wasn't available in 1918. However, if we outstrip our medical care, in other words, we have more cases than can be cared for, that's when you'll see fatality soar, similar to 1918. So we're at a real turning point right now. We really do need to follow public health strategies, side on the side of caution, and really tighten down and batten down the hatches these next couple of weeks until this peak subsides and we get the vaccine. The light is at the end of the tunnel. We just need to hang on.
There was some lessening of travel over the recent Thanksgiving holiday, but do you think it was enough?
Absolutely not. I think it's very problematic with what I've seen. I'm very scared we're going to have another surge. If you are traveling or you did travel, it is recommended that you get a test. I've heard anywhere from 3 to 5 to 7 days out, and that you should be quarantining yourself for at least 7 days, possibly up to 14. I'm hearing different things from different authorities. I mean, there were so many people, it's hard to quarantine half the United States. But nevertheless, the median incubation period for COVID-19 is 5 days. So you certainly want to quarantine yourself longer than 5 days. 2 weeks would be best. At least do 7 to 10 days. I know it's hard. It's a lot to ask. But if we outstrip our sources and have another surge, it's going to be very problematic. And if we then repeat this during Christmas, it's it's just going to be really something that I think will be a very heavy price to pay for people not following public health strategies.
Dr. Kevin Kavanagh, so incredibly generous with his time and expertise.